Well, if one of your listeners has been told they have non-specific low back pain or they've read a study about non-specific back pain, my view is there's no such thing. It just means they have not had an assessment.
Right.
If that patient or individual has undergone a thorough assessment that has involved provocative testing, which involves finding motions, postures, and loads that cause the pain and make it worse, you've identified a good part of the cause.
Right.
And now that gives you a very solid clue as to how to proceed with the treatment. So the causes of back pain, I wish I had a simple answer for that, but I'm not going to default and say we don't know. In fact, I would take the opposite view and say we know precisely what causes back pain if we can look at the individual. So if we saw, just to take an example, of someone with a disc bulge, posterior lateral on the left-hand side with a focal distribution. Now that sounds like a bunch of mumbo-jumbo, but we've created enough of those to know that that person was flexing forward and bending to the right repetitively over and over again. And we also know a lot about the shape of their discs, which there's quite a variety in the population as well. So again, if someone comes in with a very specific type of pain and we can replicate that, we can get at what the cause is quite precisely. But generally, it's people who have repetitive movement patterns that are non-optimal for their body and their injury history.
Yeah.
What they do, if they're training and working out, what they do for the other 23 hours very much should determine the components of their exercise program and whether it's appropriate or inappropriate. So it really is the full gamut. And just to let your listenership know, Chris, when I see a patient, it takes me about 3 hours to perform a thorough assessment and come up with advice on what they should not do and what they should do.